Voters were asked to decide 3 ballot questions, including whether or not to renew a health tax for the medically indigent. Question 1 was approved with a whopping 6% saying yes. Was that a shock, Lynn Horsley?
No, it really wasn't. I mean, the margin of victory was a shock, I think. But people do still have a lot of uncertainty about the Affordable Care Act, how exactly that's going to play out. And I think a lot of people feel like the money has been well spent since the tax was first approved in 2005. And I think people are worried that they may someday need this type of care if they lose their health insurance.
Sam?
Well, there's still a lot of uncertainty, as Lynn said, about Obamacare. There has been some movement in the Missouri General Assembly, perhaps a compromise that could lead to Medicaid expansion. There seems to be no movement in the state of Kansas, although they still haven't said no to Medicaid expansion. So I think Lynn's right. There is a lot of uncertainty about how people in Kansas City are going to get their health care going forward.
I'm sympathetic to the uncertainty, but I think a question that I have and a lot of people have is why 9 years? Why not make it a 4-year tax extension? And you know, to the point about Medicaid expansion, I don't know how much further you can expand it. 50.1 million people in this country are on Medicaid. That's 1 out of every 6. And that doesn't include Medicare, which has another 48 million people on it. 1 out of every 3 people in this country get their health benefits, or at least some of their health benefits, from the government. How much further can we expand this?
Now, what have we learned then this week, then, based on what Scott Parks is saying, Dave, from, first of all, this election, where not only did 76% of the public say yes to this, when there was a lot of concerns about what was happening with the Affordable Care Act and a huge extension of this particular health levy for the indigent over a long period of time. It also did very well in Clay and Platte counties. Traditionally, we're not going to necessarily support a tax. But also in the Missouri legislature, we're hearing now Republicans may be favorable to at least expanding Medicaid in that state, too.
Right. 2 things there, Nick. First, one of the reasons it was strong in the Northland, as opposed to, say, the first time it passed, 2005, I think, was a lot of it, not a lot, some of the levy goes for ambulance service. And there continues to be a concern north of the river about slow ambulance response times. And the thought was, if we don't pass this, ambulance service is going to deteriorate. Remember, it's for a $100,000 house, it's about $4 a month, a little less. People didn't see that as an overwhelming levy to keep this program going. Now, on the Medicaid expansion, you're exactly right. There does seem to be some evidence that some Republicans, not all in Jefferson City, are looking for a way to take this federal money, hundreds of millions of dollars over the next 3 years, to expand health care coverage for the poor without admitting that they like Obamacare or they're in any way continuing the Affordable Care Act. That is a very difficult needle to thread, and they're trying to do it. Whether they get it done by adjournment isn't clear.
Sam?
Yeah, what's going on in Jefferson City is they're looking at a model they're using in Arkansas where this money would be used to funnel into private coverage, which would then be Medicaid expansion. Although payments wouldn't come from the government, they would essentially be using that money to buy private health insurance. And I think that's what makes it more palatable to Republicans in the General Assembly. Let me just also quickly add that hospitals live in fear of Medicaid not expanding. In 2014, the government is going to drastically reduce payments it makes to hospitals for uncompensated care. Hospitals are very worried about what happens in 2014 when those payments get cut.
Okay, quickly, 2 other questions on the ballot. Voters overwhelmingly approved taxing nonprofit groups when they host conventions in the city. And voters resoundingly reject question 3, a citizen initiative related to the new nuclear weapons component plant in South Kansas City. Any wailing and gnashing of teeth on those, Lynn?
No, the question 2 was kind of a loophole.
Okay.
Kansas City was the only city that provided this exemption to nonprofits, and it was costing the city $2 million a year. And then on the third one, the Citizens Initiative, the peace advocates had almost no money, and they were up against the establishment and labor groups who may appreciate this idea that it'd be nice if we could get rid of nuclear weapons, but we need the jobs in Kansas City, and I think people felt like this Citizens Initiative was not going to affect the national
They weren't debating on your radio station, Scott?
Sure they were. Full disclosure, my ex-wife works for the company that was targeted in question 3. But let's be clear. Nuclear weapons are not made in Kansas City. Components that go into nuclear weapons are manufactured in Kansas City, and there is a huge difference.